This is our third video on pathomorphology, meaning at the end of this presentation, we would have solved 90 questions. All right, so we begin. A skin of a man who died from cardiac insufficiency has an eruption in the form of spots and specks. Guys, this alone should give you your clue. Spots and specks. All right, so we're saying that the skin of a man who died from cardiac insufficiency has an eruption in the form of spots and specks. And I am saying, or we are saying, that spots and specks are classic clinical manifestation of a certain disease. It's very, very classic. And it is a tick-borne disease. It is a tick-borne disease. Usually, the name of the disease is called what? Spotted fever, just as the eruptions describes, spots and specks. So this is what? A spotted fever. However, for the sake of learning, let's look at the other presentations. There are also bed sores in the area of the sacrum and the spinous vertebral processes. Examinations of the CNS, microscopic examination of the CNS, skin, adrenal glands revealed vesicles of microcirculatory bed, and in small arteries, disruptive proliferative endothrombovasculitis with Popoff's granulomas. All right. And we have one interstitial myocarditis. But the long and short of this whole question is that this person is suffering from spotted fever. Why? Because of your clue for spots and specks. Spot and speck. But again, keep this granuloma in or as part of the granuloma that I sent to you. The Popoff's granulomas. Popoff's granulomas. Add it to the syphilis and those ones that I gave you. So this is what? C, spotted fever. Spotted fever. All right. Autopsy of a 17-year-old girl who died from pulmonary failure revealed a small area of caseous necrosis in the inferior lobe of the lung and occurrence of the caseous necrosis in the bronchopulmonary, the bronchial, and in the bifurcational lymph nodes. What is the probable postmortem diagnosis? So what kind of disease are we looking at for in this question? And over here, we are, for the fact that there's what? A gaseous necrosis, we are looking at for what? A primary tuberculosis. A primary tuberculosis. Don't forget of what? Tuberculoma. You know, in tuberculoma, there's a specific what? Dimension or diameter that you should be what? Looking out for. That you should be what? Looking out for. So this one is a primary, how do you call it? Tuberculosis. Now, the primary site of infection, is actually known as what? The Gons focus. G-H-O-N, Gons focus. Gons focus. Gons focus. However, it is generally located in the upper part of the lower lobe. Located in the upper part of the lower lobe or the lower part of the upper lobe. Take note, it usually occurs or it is found at the upper part of the lower lobe or the lower part of the upper lobe. Of the upper what? Lobe. And again, we also say this is also what? Primary. Now you might be thinking that this is what? This is secondary. And of course, you might have a case. But in primary tuberculosis, it is the infection of an individual who has not been previously infected or immunized. So if this is the first time the patient is having this kind of disease or this type of tuberculosis, again, we are referring it to as what? As a primary tuberculosis. If it is secondary tuberculosis, this would have been what? The second time. Or they would have mentioned a problem with what? With a previous what? History. But even though they said he died of pulmonary failure, they didn't tell us the exact what? Pulmonary failure that it was. But again, the pulmonary failure was as a result of the primary what? Tuberculosis, because that was the first time he is getting infected. Because there's no much information about it. So we can't say this was gaseous pneumonia under secondary tuberculosis. No. This is primary tuberculosis. So here we'll go in for A. All right. Autopsy of a man who died from sepsis. Already you know what sepsis is. Severe infection. In its femoral bone revealed phlegmonous inflammation. Again, we have done something with what? With phlegmonous inflammation. Phlegmonous inflammation. We are thinking of what? A necrosis, and we are thinking of what? Of ulceration. Necrosis and ulceration. Now, so there's phlegmonous inflammation that affected the marrow, the Hevesian canals, and then the periosteum. Under the periosteum, there are multiple abscesses. Adjoining the soft tissues of the thigh also have signs of phlegmonous inflammation. The question is, what pathological process was being what? Described? What pathological process is being described? So definitely, this is what? An inflammation of the bone. This is an inflammation of the bone of pyogenic origin of pyogenic organism or microorganism. When we say pyogenic, we're referring to a bacteria that can cause what? Inflammation. We are talking about a bacteria that can cause what? Inflammation. So this is what? Osteomyelitis. And osteomyelitis is what? Is inflammation of the bone that is caused by a pyogenic organism. And we know that this type of infection normally occurs primarily in children. And usually it spreads through the blood. So we call it what? Hematogenous. So it is what? A hematogenous, or it has a hematogenous mode of what? Infection. So it passes through the what? The blood. It passes through the blood. Now, in adults, osteomyelitis is usually subacute or chronic. Again, in adults, it is usually what? Subacute or chronic. And again, acute develops within weeks after the disease what? Onset. It occurs within weeks. And for chronic, it takes months. Before what? It ensues. So over here, we are definitely thinking of what? Acute hematogenous osteomyelitis. So this should be A. All right. I love this question because you people know it already, but it is in a different way. The experimental enema was first sensibilized, whereupon an antigen dose was introduced subcutaneously. What it means is that this person is what? Allergic to that what? Antigen. So they have to what? Sensitize the person so that the person will not react to that infection again. Now, this injection resulted in the development of fibrinous inflammation, which, with alteration of the vessel walls, basal substance, and blah, 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 blah. The question is, what immunological reaction took place? So again, we are thinking of what? Allergic what? Reaction. We are thinking of what? Allergic reaction. So what type of allergic reaction is it? Of course, type 1. Type 1. We've mentioned the type of diseases. We said in allergic reaction, it is what? Type 1. Type 1. So if you've not watched the videos, please do well to get the video and watch it. All right. So the answer is A. Again, we've answered this question, but in a different way. Examination of a 55-year-old woman revealed under the skin of submandibular area a movable, slowing, growing pasty formation with distinct borders. Histologically, there is liposide, that means lipids, that form segments of different forms and sizes, separated from each other by a thin layer of connective tissue with vessels. What is it? Definitely, you are thinking of a benign tumor of fat tissue. A benign tumor of fat tissue. So your answer is what? Lipoma or lipoma. All right. We've done it, so I don't want to waste time on it. Good. A 4-year-old child complained of pain during degglutination, that is swallowing, indisposition. Now, the palatine arcs and the tonsils are moderately edematic. Moderately edema, that means there's what? Inflammation. There is hyperemia, or it is hyperemic, with grayish white films of up to 1 millimeter thick, closely adhering to the subjacent tissues. The question is, what pathological process are these changes typical for? Of course, you are thinking of what? Now, they told you that there's what? There's grayish white film. So you are thinking of what? A fibrinous type of what? Inflammation. Fibrinous type of what? Inflammation. A fibrinous type of what? Inflammation. And when we talk about fibrinous, it could mean that it could be Krupus or it could be what? Diphtheric. Krupus or diphtheric. So in all, we are referring to what? Inflammation. We are referring to this as what? Inflammation. Because inflammation, of course, is a response of the immune system. It's the response of the immune system to antigens or to pathogens, basically. So usually you will see all these cells present, or we call it molecular mediators or cytokines. So all these are what? Inflammation. But again, this is what? A fibrinous type of inflammation. Again, we have discussed what fibrinous really is all about. All right. A 9-year-old child has developed dentition. That means teeth is coming, right? No, sorry, delayed dentition. That means teeth is not coming. It is also out of order. The upper jaw configuration is horizontal, microscopically irregular. Mineralization of the tooth enamel. There's irregular mineralization of the tooth enamel. Again, what controls mineralization? Yes, you are thinking about what? Calcium. You are thinking of calcium. So when it's a deficiency of calcium, you are definitely thinking of what? Rickets. But this is what? A 9-year-old. So a deficiency of calcium, of course, by vitamin D, then we are having what? Ricket formation. But since the child is just 9 years old, we can refer to this as what? Early rickets. All right. Good. Okay. Microscopical renal examination of a 36-year-old woman who died from renal insufficiency. That means problem with the kidney. Revealed glomerulus proliferation of the capsule. So there is what? Glomerulonephritis. Because there's what? Inflammation going on there, proliferation. As well as the podocyte and the phagocyte accompanied but the formation of crescent capillary loop necrosis, fibrinous trumps in their lumens, sclerosis, hyalinosis of glomerulus, atrophy of tubules, fibrosis of renal stroma. What is your diagnosis? So definitely you are thinking of this as what? As a glomerular what? Nephritis. But what is the type? Is it acute, chronic, or subacute? And ladies and gentlemen, this is subacute. And in subacute, it is characterized by the symptoms of course, glomerulonephritis like proteinuria, hematuria, edema, azotemia, persisting for many days and even weeks. And the renal changes include those of rapidly progressive and membranoproliferative glomerulonephritis. Now, it is rapidly progressive. That's why it is what? Subacute. Now, so usually we are not having a clear-cut difference between the acute and then the subacute. But subacute is like what happens within few days. That's what acute. Now, subacute can take some days and even weeks. Okay? Can take some days or even what? Weeks for it what? To happen. And it has a progressive form. So then the disease is progressing very rapidly. That is why we classify it as what? As a subacute. Then in chronic, of course, you already know that it has been there for a very, 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 very long time. That's the chronic. So here we will go in for what? Subacute. But of course, acute and subacute are debatable. It is debatable. But this we will go in for what? Subacute. Subacute. All right. A forensic medical expert examines the body of a 58-year-old man who had been consuming large amounts of alcohol for a long time and died at home. Microscopically, the right lung is dense and enlarged. Its incision revealed the tissue is grayish and homogeneous. The pleura is covered with grayish layers. Now, alveolar cavities contain fibrin and hemolyzed erythrocytes. Make your diagnosis. Make your diagnosis. Again, we are thinking of this as lobar or Cropos pneumonia. Lobar or Cropos pneumonia. And usually it has an acute progression. Acute progression. Now, there are 4 stages. 4 stages of Cropos pneumonia. 4 stages of Cropos pneumonia. So let's look at it one after the other. Now, the first stage is called stage of congestion. State of congestion. So congestion in the first 24 hours. And it is usually characterized histologically by vascular engorgement, intraalveolar fluid, that means fluid is there. There is small number of neutrophils. Now, if you look at the morphology again, you'll be looking at what? You read that the lung is very heavy and hyperemic. It is heavy and hyperemic. So that is the first stage. Second stage, we are thinking of red hepatization or consolidation. Red hepatization or consolidation. This is when the vascular congestion persists with destruction of red blood cells into the alveolar spaces. Into the alveolar spaces. Into the alveolar spaces. So in this case of this question, you could be thinking of what? Red hepatization. You could be thinking of what? Red hepatization. And we call this red hepatization because of its color. Because of its color. It is very red because that tells us that there's a lot of what? Erythrocytes being present at that place. Being present at that place. Then the fourth stage, we have the gray hepatization. And over here, So this one we're having what? Red hepatization, and we're having what? The pleural is covered with grayish layer, which is what? Gray hepatization, where the red cells disintegrate with persistence of neutrophils and fibrin. Persistence of neutrophils and fibrin. And over here it contains what? Fibrin. So this means that the red hepatization is giving way for gray hepatization. Is giving way for gray hepatization. And the fourth and the last stage is the what? The recovery stage. The recovery stage, where everything begins to clear. So over here, we are talking about Kropos pneumonia. Kropos pneumonia. And again, what stage can you be thinking of? You could be thinking of what? Gray hepatization. Gray hepatization. That means the red is giving way for the gray to come in. Great. Okay. So look at the question again. Autopsy of a 50-year-old man revealed the following changes. His right lung was moderately compact in all parts. Dissected tissue was found to be airless, fine-grained, dryish. Visceral pleura had grayish brown layers of fibrin. What is it describing? Gray hepatization. So it is classic for Kropos pneumonia. Kropos pneumonia. So your answer is what? A. Autopsy of a 56-year-old man revealed right temporal part of the brain, a big focus of softened gray matter that was semi-liquid and light gray. Arteries of the cerebral tela contain multiple whitish yellow thickening of enema that abruptly narrowed the lumen. What it tells us is that when the cerebral arteries are narrowed, what happens? It means there will not be what? How do you call it? There will not be blood going on to the what? To the brain. So as a result, the brain undergoes what we call what? Necrosis. The brain undergoes what? Necrosis, because it's lacking blood, and blood contains oxygen, and no oxygen is there to supply the brain. So it is going through a process called what? Necrosis. But the medical term is called what? Stroke. Medical term is called what? Stroke. And now stroke can be hemorrhagic or it can be what? Ischemic. When we say hemorrhagic, it's as a result of what? Bleeding. And when we say ischemic, it's as a result of what? Narrowing of the lumen. So that means there's inadequate of what? Supply of blood. And that is what is actually happening in this gentleman who passed away. So this year, we are referring to what? An ischemic stroke. Ischemic stroke. All right. I love this question too because I will not bother myself explaining again. Somebody's asking a question. Okay, I'll attend to all messages. All right. Okay. A 22-year-old woman has enlarged lymph nodes. Histologically, a lymph node contains lymphocyte, histiocyte, reticular cells. They've given you big Hodgkin's cells. And look, Ray-Sternberg cells. What are you thinking about? Of course, another name for all of these things is what? Lymphogranulomatosis. We've done this, so no need for us to waste time on it. So this is what? Hodgkin's disease or lymphogranulomatosis. So this is what? Of lymphoid tissue. So we're talking about the lymphoid tissue. So here is D. All right. Analysis of a punction biopsy material of a liver revealed hepatocyte dystrophy. That means the cells are being destroyed with necrosis as well as sclerosis. That means even the hepatocytes are being replaced, or the cells are being replaced with scar tissues. Now, there's a formation of a pseudo-lobose and regenerative node. What is the cause? I mean, what is the diagnosis? Definitely, when there's a scarring or a replacement of the normal hepatocyte with scar tissues or fibrous tissues, definitely we call it what? Liver cirrhosis. We call it liver cirrhosis. So your answer is D. D. All right. Autopsy of a man who had been suffering from multiple bronchiectasis. That means dilatation of the bronchioles. 5 years, for 5 years, died from chronic renal insufficiency. Revealed that the kidney were dense and enlarged with thickened cortical layer of white color with greasy lustril. What renal disease might be suspected? Now, when they tell you there's a white color with greasy luster, these are actually what? Proteins. These are abnormal what? Proteins. So abnormal proteins as a result of the cardiac insufficiency are accumulated in the kidney. And this is called what? Amyloidosis. Amyloidosis. Of course, secondary amyloidosis, because the amyloidosis occurred due to what? A problem already in the heart or the lungs. The lungs. So it has an underlying cause. And the underlying cause is what? Is the fact that there's what? Chronic renal insufficiency. So proteins, abnormal proteins, fibers developed at the place. So here we are thinking of what? Secondary amyloidosis. Again, you are thinking of what? White color with greasy lustril. Great. Okay. We have an autopsy. I like this question too. We have an autopsy of a 49-year-old woman who died from chronic renal insufficiency. They were what? Kidneys were dense, reduced, multicolored with hemorrhagic areas. Microscopic examination revealed some hematoxylin bodies in the nucleus of the renal tubule epithelium. There's wide loop thickening of the glomerular capillary basement membrane here and there in the capillaries. And blah, 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 blah. What is the most likely diagnosis? What is the most likely diagnosis? This wide loop thickening refers to what we call lupus nephritis. Lupus nephritis. Lupus nephritis. Wire loop is classic for what? Lupus nephritis. And it is an autoimmune disease. So basically, since it's coming from lupus, since it is lupus, the bigger name or the mother name for this lupus nephritis is actually what? Systemic lupus erythematosus. Systemic lupus erythematosus. And again, if you don't see this white loop present, you could be seeing what you call a butterfly rash. A butterfly rash or a malar rash. Malar rash. So you have 3 things as your clue for systemic lupus: butterfly rash, malar rash, or white loop. When we say white loop, it's occurring inside the kidney. Inside the kidney. Now, the malar rash and those things are occurring on the face. To be specific, on your cheeks. Okay, so this is what? Systemic lupus. Lupus. All right. On painful formation without marked borders appeared in the soft tissues of the thigh in the young man. On the tissue biopsy, the formation looks like a meat of fish consisting of immature fibroblast-like cells. Fibroblast-like what? Cells. So you could be thinking of what? Fibrosis. You could be thinking of what? Fibrosis with multiple mitosis which grow through the muscles. So again, you are thinking of what? Fibrosis, and of course, you know that this what is cancerous because it's going through what? Multiple mitosis. That means it is over-proliferating. Over what? Proliferating. Over-proliferating. So here you could be thinking of fibroblastic sarcoma. Fibroblastic sarcoma, also known as fibrosarcoma. And this is a malignant tumor derived from the fibrous connective tissue. Derived from the fibrous connective tissue. And of course, it is characterized by immature proliferating fibroblasts. Immature proliferating fibroblasts. Fibroblasts. But again, the key word here is what? There is the formation of what? Meat of fish. A meat of a fish. This is also what? Key, and again, fibroblast-like cells with multiple mitosis. These are your what? Your key, how do you call it? Words to help you with the diagnosis. So fibrosarcoma. A 45-year-old patient consulted a doctor about a plate-shaped formation on his neck. Histological examination of the biopsy skin material revealed tumoral cells of round and oval form with thin ring of basophilic cytoplasma. Basophilic cytoplasma that resembles cells of the basal epidermal layer. So what tumor is it? Of course, it's kind of a tumor resembling what? Basal epidermal layer. And that is called what? Basal cell carcinoma. Basal cell carcinoma or basal cell cancer. Basal cell cancer. And this is the most common type of what? Skin cancer. It is the most common type of skin cancer. And another name for basal cell carcinoma of the skin is actually what? Basalioma. Basalioma. So your answer here is what? B. Basal epidermal. So don't go and choose epidermal cancer, but rather what? Basal cell what? Carcinoma. Great. I like this question because we've just asked a question on it. So, Dr. Yima, you remember this question? A 63-year-old man fell ill with acute tracheitis. And we know that acute tracheitis has to do with what? Upper respiratory infection. And again, what is the major cause or the most common cause of upper respiratory diseases? Yes, you are thinking of what? Influenza. You are thinking of influenza. And again, you know that influenza has some complications that can affect the lower part of the lungs or lower respiratory what? Infections. But let's look at it. Now, this patient fell ill with acute bronchitis and even what? Acute tracheitis and bronchitis accompanied by bronchial pneumonia. On the 12th day, the patient died from cardiopulmonary insufficiency, just like the previous person who died. Autopsy revealed fibrinous hemorrhagic laryngotracheobronchitis. Lungs were enlarged. Their incisions were revealed. Cold minus effect caused by interlacing of section of bronchial pneumonia, blah, blah, blah. The question is, what is the cause? What is the cause? So look at the viruses over here. What can you possibly think of? Of course, influenza of severe form. Severe influenza infection. We have talked about this in today's tutorials. The first one. All right. Autopsy of a man who died again from influenza revealed that his heart was slightly enlarged, pastors, myocardium was dull and had specks. Examination, we have what? Myocardial revealed signs of what? Parenchymatous adipose and hydropic dystrophy. Hydropic dystrophy. Stroma was edematic with poor macrophagal and lymphocytic infiltrations. Vessels were Plethoric perivascular analysis revealed pituitary hemorrhages. What type of myocarditis developed in this case? What type of myocarditis developed in this case? So first of all, we know that this patient is definitely having what? A complication from the influenza virus. From the influenza virus. And you know one thing about influenza virus is that though because they are viruses, they do not have effect like bacteria. You know, bacteria normally leads to what? To what do you call it? Fibrinous or purulent type of what? Inflammation. It leads to purulent type of what? Inflammation. But this is what? Of viral origin. And in viral origin, they normally lead to what? A clear fluid. Clear fluid. And again, we said a clear fluid means what? Means serous. A clear fluid means what? Serous, or non-viscous fluid means serous. It means serous. So over here, we are looking at for what? And it is diffuse because all over the heart is there. And again, look at one key feature over here. They said the stroma was edematic with poor, this is macrophages and lymphocyte infiltration. Poor macrophages and lymphocyte infiltration. And we know that when we have bacterial inflammation, macrophages and lymphocytes will not be poor. In fact, they will work massively. They will work massively, isn't it? So again, this helps us to know that indeed the fluid is what? Of serous. It's of serous. And it's occurring all over the heart. So this is a diffuse. It is not focal. In focal, they will give you a demarcation, or they will tell you from 2 centimeters to that, or to that. But over here, there is nothing of such. So it is not focal. It is not focal, but rather what? Diffuse. Diffuse. All right. Good. We've done this. Crimson. By the way, let's continue. A 7-year-old boy, objectively, against the background of hyperemic skin, there is a noppy bright pink rash on the forehead, bright pink rash on the neck and on the bottom of the abdomen, in the popliteal spaces, nasolabial triangle. Examination revealed oropharyngeal surface, revealed bright red hyperemia. Tonsils are swollen. Soft, lacunous contained pulse. Tongue is crimson. Cervical lymph nodes are enlarged, dense, and painful. What are you thinking about? What are you thinking about? Now, they've given you a characteristic of what? Bright red rash. Bright red rash. This is typical for what? Scarlet fever. Typical.
Sir, we can't hear you.
Hey. But I can hear you. Hello. Can you guys hear me?
Yeah,
Sir, it was breaking, so if you could start again.
Okay. You know other people have been messaging back. I can't see because I'm focusing on the questions. All right. Again, we are saying that a boy, a 7-year-old, now against the background of hyperemic skin, that means redness of the skin, there is bright pink rash on his forehead. And I'm saying that this is very, very specific for scarlet fever. For scarlet fever. Very, very, very specific for scarlet fever. And not only that, it is also accompanied with what? High fever. Unfortunately, they didn't really mention anything about fever, but it comes with high fever and then sore throat. High fever and then sore throat. So, but over here, they said the tonsils are swollen. This is sore throat. The tonsils are swollen. Tonsils are swollen. And they are also what? Soft. The lacuna contain pus. And then the tongue is crimson. And I'm saying these are all signs, or they are very, very characteristic for Scarlet fever. Scarlet fever. So that's why here your answer is scarlet fever. Scarlet fever. Why? Again, I said because of what? The bright red or the bright pink rash on the forehead, and the fact that there is what? Tonsillitis or sore throat. There is sore throat also what? Present. Sore throat is present. Of course, they're supposed to be what? Temperature. But unfortunately, they didn't mention the temperature. But these are the classic signs for scarlet fever. Scarlet fever. So here, your answer is D. All right. We have a gynecological examination of the uterine cervix in a 30-year-old woman. There is bright red lustrous spots that easily bleed when touched. Bleeds when touched. It is that soft. Biopsy showed that a part of the uterine cervix was covered with cylindrical epithelium with papillary outgrowth. In the depth of the tissue, the growth of the glands was present. What uterine cervix was revealed? What uterine cervix was revealed? So over here, we are looking at for what? For a pseudo erosion. Pseudo erosion. Now, true erosions exist not more than 2 weeks. It exists not more than 2 weeks. It exists not more than 2 weeks, and it passes into the second stage, which is called what? The pseudo erosion. For more than 2 weeks, we are referring to what? A pseudo erosion. Pseudo erosion. Pseudo erosion. So typically, we are talking about what? Pseudo erosion. All right. So here, your answer should be what? Pseudo erosion. Pseudo erosion. If you want more clarification, please let me know and I'll go over it again for us. I'll go over the types of erosions we are having over here for you guys. So do let me know and I'll come back to it. All right. We have a stillborn child was found to have a thickened skin resembling the tortoise shell and the developed auricles. Historical examination of the skin revealed hyperkeratosis. There is hyperkeratosis, atrophy of the granular epidermis layer, and there's what? Inflammatory changes were not present. Inflammatory changes were not present. What it means here is that there's a disorder. So this is actually a disorder that is characterized by dry, thickened, scaly skin resembling that of a tortoise shell. And this is known as ichthyosis. 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 That is the medical term for a dry, thick, scaly skin. Dry, thick, scaly skin. So your answer here is what? Is D. Is D. Is D. All right. I like this question again because we have already done it. Acute renal impairment caused death of a bleeding patient. Autopsy revealed enlarged kidneys with a broad, pale pink cortical layer, expressively demarcated from dark red renal pyramids. Renal pyramids. Do you remember what we talked about? Acute tubular necrosis. Acute tubular necrosis. And these form part of the renal tubules of what? The kidney. Now, microscopic examination revealed a lack of epithelium nuclei of convoluted tubules, tubuloresis, phlebistosis, cell nuclei of choroid, glomus, and straight tubules were present. What are you thinking about? again, you are thinking of what? Acute tubular necrosis, also known as necronephrosis or necrotic nephrosis. We did it earlier, and I said it is a medical condition that involves the death of tubular epithelium tissue or epithelial tissue, tubular epithelial tissue. And you know that all of these are all what? The tubular tissues, convoluted tubule, and all of these are all tubular what? Tissues. So when there is death of that tissue or there's necrosis of that tissue, then again, why is there necrosis? Look, there's dark red renal what? Pyramids, all of them being what? Present. So here again, you are thinking of what? The death of the tissues. So here you are going with what? Necronephrosis. All right. Again, we have done this, but it is in a different way. They said a pathology, histology laboratory received a vermiform appendix up to 2 centimeters thick. Its serous membrane was pale, thick, and covered with yellowish green films. Wall is flaccid, grayish red color. Appendix lumen was dilated and filled with yellowish green substance. Histologically, look at it. They revealed the appendix was what? Infiltrated with neutrophils. Specify the appendix what? Disease. Specify the appendix what? Disease. Again, I spoke about phlegmons or phlegmonos. We said phlegmonos is a combination of what? Of ulcer and what? Necrosis coming together. Ulcer and necrosis coming what? Together. And that is exactly what we are experiencing in this what? Appendix. And even in the other question, it was the same what? Appendix that was having these signs and what? Symptoms. And again, we said because of the, look, it is dilated and filled with grayish green substances. The infiltrate of what? Neutrophils are also what? Present. So all of these are also what? Inflammatory what? Reactions. Inflammatory reactions. So again and again and again, we can be thinking of this as what? Acute phlegmonous appendicitis. Acute phlegmonous appendicitis. Acute phlegmonous appendicitis. And again, what is your clue? The clue here is what? The appendix or the lumen was dilated and filled with yellowish green substance. Yellowish green substance, which is more or less like, they're like abscesses. So here you're going for what? For E as our answer. All right. A 46-year-old patient who had been suffering from tuberculosis for 6 years died from pulmonary hemorrhage. Autopsy revealed different sized foci of sclerosis and gaseous necrosis in the lungs. In the upper part of the right lung, there were cavity of what? 5 centimeters in diameter. Cavity, 5 centimeters. Now, if they are talking about tuberculosis and talking about cavities, then you're referring to what? A cavernous. A cavernous. That is what? Cavity, cavernous. Now, but look at it. This is filled with dense gray wall. Okay, it has dense gray wall. The cavity contains a liquid blood and blood clots. Liquid blood and blood clot. So the question now is, what type of necrosis are we looking at? What type of necrosis are we looking at? Again, this is what? It's a chronic destructive clinical tuberculosis. Chronic destructive clinical tuberculosis. And this is characterized by the presence of a cavern, or when we say a cavern, old fibrous cavity in the lungs tissue that is surrounded by what? Fibrosis. Now, macroscopically, the lesions are spherical and cavitatory. Spherical and cavitatory. Microscopically, the outer wall of the cavity shows fibrosis or sclerosis. And over here, they've told us that the autopsy revealed different foci of sclerosis, also meaning fibrosis, and gaseous necrosis in the lungs. So again, what can you be thinking about? Definitely, we are thinking of what? A fibrocavernous. So here, we can easily go in for what? For B as our answer. Again, you are looking at what? The sclerosis, the gaseous necrosis, all being formed. And of course, when there's necrosis, there can also be what? Accumulation of what? These blood clots present. So here, we are thinking of what? Fibrous cavernous. If there was no cavern, then of course, you could be thinking of what? Fibrous focal. You could be thinking of what? Fibrous focal. But no, there is what? Cavities or cavitatories. So your answer is B. Good. A patient died from cardiovascular pulmonary decompensation. Histology revealed diffuse pulmonary affection along with interstitial edema, infiltration of tissue by lymphocyte, macrophages, plasmocyte. That is, there is what? Inflammation going on. Pulmonary fibrosis and pan-acinar emphysema. What is the most likely diagnosis? Again, you are thinking of what? Interstitial pneumonia. And this is a form of lung disease that is characterized by a progressive scarring of the lungs. And as you can see, there's inflammation and there's a progressive scarring. There's fibrosis, there's pan-acinar emphysema, and so on and so forth. And another name for interstitial pneumonia is called fibrosing alveolitis. That means that the alveoli is being replaced. The cells in the alveoli are being replaced with what? With fibrous tissue. So over here, we can easily be thinking about what? Fibrosing alveolitis. So your answer is B. All right. A 50-year-old patient has been taking treatment thrice for the last 6 months because of fractures caused by domestic accident. Microscopic examination of the bone tissue revealed foci of lacunar resolution, giant cell granulomas in the tumor-like what? Formation. Bone tissues are substituted by fibrous connective tissue. Examination revealed also adenoma, cancer of the thyroid gland, and hypercalcemia. What are you thinking about? Of course, you are thinking of what? Osteodystrophy. That means bone destruction. And again, they are telling you that there's a cancer of the parathyroid gland. So definitely you are looking at what? Parathyroid osteodystrophy. Now, hypercalcemia, Of course, it's also due to what? The adenoma. And this is possibly causing what? Hypervitaminosis. 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 And this can lead to increased bone resorption. That when we say bone resorption, it means bone what? Destruction. It can destroy the bone. It can destroy the bone. It can destroy the bone. And that is why the bone is being replaced with what? Fibrous tissues. So here we are thinking of what? Parathyroid osteodystrophy. So your answer is A. I love this question too because we have talked about it. 2 days ago after labor, a woman developed shock along with DIC syndrome that caused her death. So there's shock, DIC, death. Look at the autopsy. There was purulent endomyometritis, regional purulent lymphadenitis, purulent thrombophlebitis. There are also dystrophic alteration and interstitial inflammation of parenchymal organs. What are you thinking about? Definitely you are thinking about what? An infection that is spreading through the blood. You are thinking of what? Infection that is what's spreading through the blood. And the term here is called what? Sepsis. Sepsis. And I said again, so this year we are looking for what? Septicemia. Septicemia. And septicemia is a form of what? Sepsis. It is a form of sepsis. And again, in this form of sepsis, hemorrhagic syndrome is very pronounced. Hemorrhagic syndrome is very, very pronounced. And of course, septicemia can lead to shock. Septicemia can lead to shock. And even the DIC can also what? Lead to shock. So here, we are thinking of what? Septicemia. Septicemia. All right. 2 hours after skeletal extension was performed, a 27-year-old patient with multiple traumas, close injury, blah, 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 his condition abruptly became worse and the patient died from chronic cardiopulmonary decompensation. Guys, do you remember when we talk about embolism? Yes. Thromboembolism means there is a thrombus that's going on into the what? The heart. And I told you guys that there's also another type of embolism called what? Fat embolism. That occurs as a result of what? Bone tissue of fractures. So when a piece of bone break off, it can go and cause what? Cardiopulmonary what? Problems. And look at it. Multiple traumas. Close fractures of the right eye. Do you understand? So over here, we could be thinking of what? Fat embolism. So here,
please, can you repeat this one because the network was breaking. We couldn't hear you at all.
Okay. Today, my network is disappointing me.
Sorry.
No problem. Like I said, we are having what? Multiple traumas over here. And when I was talking about thromboembolism, where it finally leads to pulmonary thromboembolism, what do we have? We have a blockage in the pulmonary or in the lungs, leading to what? Problems. It can lead to, how do you call it? Pulmonary edema and all sorts of things, and breathing becomes difficult and so on and so forth. And that is because of what? There's inflammation of the deep vein in the lower limb or phlebitis. Now, we also made mention that another reason that can cause embolus to get lodged in the lungs is what? Fat tissue. It's not really fat, but fractures. So when there's a break of bone, which goes on to lodge into the heart or into the lungs, to be specific, we call it fat embolism. Now, in thromboembolism, it is normally seen when a patient is having what? Problem or a bleeding problem in the deep vein of the lower limbs, of the lower limbs, of the lower limbs. So that is what happens. And in gaseous, people who like diving, no, I think air embolism and gaseous embolism, they're only the same. Those who like flying in the air, okay, those who like flying in the air, they have this kind of embolism. So here we are thinking of what? Of fat embolism. Fat. Because of what? Multiple traumas, multiple fractures. All right. Good. I explained to you guys the difference between, we talk about fibroma, the different type of what fibroma. We have what? Soft and we have what? Hard fibromas. And I explained the distinction or the differences between them. Now look at the question here. A 50-year-old patient underwent resection of the tumor of large intestinal wall. Microscopically, it presents itself as a fascicles of divergent collagen fibers of different thickness and form, and some monomorphous fusiform cells that are irregularly distributed among the fibers. Cellular atypia. And anytime you see atypia, it means there's what? There is cells that are overgrowing, or there's tumor. There's tumor, right? Now I think that cellular atypia is not evident. It's not what? Evident. So that means this atypia, or whatever is on me here, it is not cancerous. It is not cancerous. However, what tumor? You know, not all tumors are cancerous. Hope you know that. Some are benign. Some are benign, just like the case of fibromas. So definitely we are looking at what? Fibers here. So we are thinking about what? Fibromas, or we are thinking of what? Of a fibroma. And again, I made a thin line differences between the hard and then what? The soft. But for the sake of revision, I will repeat it again. Now, I said fibromas are benign tumors that are composed of what? Fibrous or connective tissues. Fibrous or connective tissue. And if you look over here, collagen fibers are all what? Connective tissues. Now, when we talk about hard fibroma, it consists of many fibers and then few cells. Many fibers and then few cells. Soft consists of what? Many cells and then few fibroid tissues, or few fibers. Many cells but few fibers. In hard, we have what? Many fibers but few what? Cells. So here we are having vesicles of what? Divergent collagen fibers of different thickness and form. Different thickness and form. And this again is clear that there are a lot of what? Fibers present. And so therefore, we can easily go in for what? Hard fibroma. Hard fibroma. Hard fibroma. So ladies and gentlemen, this is hard fibroma.